If you could only take 6 supplements for endurance performance, recovery, and long-term health, which ones would actually make the cut? So after more than 20 years working with endurance athletes, these are the 6 I come back to over and over again because they have real evidence behind them, not just hype. And so by the end of this video, you'll know exactly which supplements are worth your money and which ones you can probably skip out on. Now, before we get into the list, there's one mistake that almost every endurance athlete makes, and that is supplements are exactly that. They're supplements. They won't replace smart training, good nutrition, or quality sleep. They enhance your physiology that's already moving in the right direction. The second mistake is buying supplements because they're popular instead of because of the fact that they actually solve a real physiological problem here. Once you understand why a supplement works and who it's actually meant for, you're going to stop wasting your money on products that promise everything but deliver very little. So let's count down the 6 supplements that I recommend most often to endurance athletes, a little bit of science behind each one of them, and exactly how I use them in clinical practice. Hey, I'm Dr. Jason Barker. I'm a naturopathic doctor, 2-time Ironman finisher, lifelong endurance athlete, and 20+ years working with endurance athletes across all ages and disciplines. Okay, number 1 is creatine. You've heard a lot about this one, and if you're an endurance athlete and you've dismissed creatine because you think it's only for bodybuilders, you're making a big mistake. It's probably the most misunderstood supplement in endurance sports because it carries that reputation as a strength and bodybuilding tool that doesn't translate to distance athletes. That reputation is way outdated, and the physiology tells a different story. Now, here's what creatine actually does. It supports the phosphocreatine system, the fastest ATP regeneration pathway that your cells have. So in endurance sports, that matters more than most athletes realize. Because every surge, every hill, every interval, every sprint to the finish, these are moments when ATP demand spikes beyond what aerobic metabolism can supply in real time. The phosphocreatine system bridges that gap, and when creatine stores are saturated, that bridge is wider and more reliable. Beyond acute ATP regeneration, creatine also appears to support glycogen synthesis and storage, which of course directly affects endurance fuel availability. And then there's emerging evidence for cognitive performance benefits under fatigue. So that matters for decision making during racing and training when you're kind of wiped out. The practical protocol here is 3 to 5 grams of creatine monohydrate daily, taken consistently. No loading phase is necessary. The research shows that a daily maintenance dose achieves that full saturation within about 3 to 4 weeks and is equally effective without the GI side effects that loading can cause. So take it any time of day consistently. The timing matters far less than the consistency, but you need to take it with some carbohydrate for optimal absorption. One clinical note here, creatine increases water retention in muscle tissue, which is actually part of its mechanism. But hydration needs to be very adequate here, and anyone with pre-existing kidney disease should consult with their provider before using it, although the evidence consistently shows that creatine is very safe in healthy individuals at standard doses. Okay, number 2 are omega-3 fatty acids. I've covered omega-3s extensively in other videos in the context of inflammation regulation, overtraining, and relative energy deficiency in sport recovery. But they belong on this list specifically for endurance performance because the mechanism is so directly relevant to how training adaptation works. Training creates inflammation. That's not the problem here. It's the adaptive signal that we need. The problem is when inflammation doesn't resolve efficiently because that's when recovery slows, soreness lingers, and performance between your sessions is going to suffer. Omega-3 fatty acids, specifically EPA and DHA, support the resolution phase of inflammation through their role as precursors to these specialized pro-resolving mediators. Now, they don't block inflammation, they help it complete and turn it off once it's done its job, essentially. That distinction matters clinically, of course. You want the adaptive signal from training to go through, but you don't need that inflammatory response to overstay its welcome. Omega-3s support that balance more intelligently than any anti-inflammatory drug, which is one of the reasons I rarely take them off the list for athletes who are training consistently. The practical protocol here is 2 to 4 grams combined EPA and DHA daily. Quality matters significantly here. Fish oil oxidizes readily, and rancid fish oil has reduced efficacy and potential pro-inflammatory effects. Look for third-party tested products with confirmed EPA and DHA content rather than relying on total fish oil dosing on the label. One clinical note, at higher doses, omega-3s can increase bleeding time, so use caution if you're on anticoagulant medications. Number 3 is magnesium. If I had to identify the single most consistently overlooked nutrient in endurance athletes, it would be magnesium, and it's not even close. Magnesium is required in numerous enzymatic reactions in the body, including those that produce ATP, the ones that regulate muscle contraction and relaxation, govern nervous system excitability, and support sleep architecture. And it's lost significantly through sweat, which means the harder and more often you train, the faster you're going to deplete it. Athletes often lose more magnesium through training than they replace, and because serum magnesium is a really poor marker of total body magnesium status, these deficits frequently go undetected. Intracellular magnesium testing provides a much more meaningful assessment, but it's less readily available in routine clinical practice. What does low magnesium look like clinically? It looks like fatigue, increased muscle tension, disrupted sleep, poor recovery, and a nervous system that can't fully downshift after training. That wired but tighter pattern I often speak of, that has magnesium insufficiency as a frequent underlying contributor. The practical protocol here is about 200 to 400 milligrams of elemental magnesium daily, with a portion taken in the evening to support that sleep quality and that nervous system downregulation. Form matters here too. Magnesium glycinate and magnesium malate are significantly better absorbed and tolerated than magnesium oxide, which is cheap and pretty common but really poorly bioavailable. Higher doses of magnesium can cause GI upset, and magnesium should be used cautiously in the context of kidney dysfunction. Number 4 are collagen peptides with vitamin C. Endurance athletes place repetitive mechanical load on their tendons, their ligaments, and the fascia, structures that are composed primarily of collagen and that have limited blood supply and slower turnover than muscle tissue does. So this is why connective tissue injuries are so common and so slow to heal in this population. The tissue is just under constant demand without the same regenerative support that muscle receives. This is why connective tissue injuries are so common and so slow to heal in this population. The tissue is under constant demand without the same regenerative support that muscle gets. Collagen peptides provide glycine and proline, the primary amino acids that tendons, ligaments, and fascia are built from. Vitamin C is a required cofactor for the enzymatic conversion of those amino acids into functional collagen tissue. So without adequate vitamin C, collagen synthesis stalls regardless of collagen intake. The timing piece is what most athletes miss, and it's supported by specific research showing that taking this combination about 30 to 60 minutes before training can meaningfully improve collagen synthesis markers compared to other timing. The proposed mechanism is that you're priming collagen turnover right before creating the mechanical stimulus that signals tissue remodeling. So the practical protocol here is about 10 to 15 grams of collagen peptides alongside about 50 to 100 milligrams of vitamin C, taken 30 to 60 minutes before your training. This is one of the most evidence-supported and underused interventions that I use with athletes who are dealing with recurring soft tissue injuries or high connective tissue load. So it's really well tolerated, but source quality matters here as well, as collagen quality varies significantly between products. Okay, number 5 is curcumin. Curcumin is the active compound in turmeric, and it's been used medicinally for centuries and has accumulated a genuinely compelling body of modern research for athletes specifically. But using it effectively requires understanding both what it does and how to use it correctly, because standard curcumin is poorly absorbed and most athletes are getting far less than the therapeutic dose here. So curcumin works by inhibiting something called NF-kappa beta, one of the primary transcription factors that drives the inflammatory signaling cascade upstream. Where omega-3s support the resolution of inflammation after it occurs, curcumin moderates the magnitude of the initial response. These two mechanisms are genuinely complementary, which is why I often use them together in athletes with high training loads or persistent inflammatory issues. So beyond inflammation, curcumin has meaningful antioxidant activity, reducing markers of oxidative stress that accumulate with sustained endurance training and those that can impair recovery when they exceed the body's buffering capacity. The bioavailability issue is real and worth addressing specifically here. So standard turmeric or curcumin supplements have very low oral bioavailability because curcumin is just poorly absorbed and rapidly metabolized. Formulations using piperine, which inhibits the metabolic pathway that clears curcumin, or phospholipid complexes significantly improve absorption, and should be the default supplemental form. Look specifically for these enhanced formulations rather than just standard turmeric extracts. The practical protocol here, 500 to 1,000 milligrams of high bioavailability curcumin formulation, 1 or 2 times daily. 1 to 2 clinical notes worth mentioning here. Curcumin can interact with anticoagulant medications as well through its effect on platelet aggregation, and it should be discontinued before surgical procedures. It can also cause some GI upset in some people at higher doses, but it's kind of rare to see that. Okay, number 6 is vitamin D. Vitamin D is one of those nutrients that gets discussed primarily in the context of bone health and immune function. And while both of those are genuinely relevant for athletes, the performance implications of vitamin D go significantly further than most athletes or physicians appreciate. Vitamin D functions more like a hormone than a vitamin in this context. So the receptors for vitamin D are present in virtually every tissue in the body, including the muscle tissue, the brain, the cardiovascular system, and the testes and ovaries. So this receptor distribution tells you something important here. Vitamin D is an influencing physiology in most of the systems that athletic performance depends on simultaneously. For muscle specifically, vitamin D supports both type 1 and type 2 muscle fiber function, protein synthesis signaling, and the neuromuscular coordination that translates training into movement efficiency. Low vitamin D is associated with reduced muscle strength, impaired recovery, and increased injury risk, including stress fractures, which are the product of both bone and muscle insufficiency. Immune connection is also directly relevant for athletes, so as we covered in the relative energy deficiency in sports series, immune function is one of the first systems to be compromised when physiological stress exceeds recovery capacity. Vitamin D is a primary regulator of immune cell function. Both the innate and adaptive immune systems, and deficiency meaningfully increases susceptibility to upper respiratory infections, which are the most common illnesses interrupting training in endurance athletes. And for masters athletes specifically, there's a consistent association between vitamin D status and testosterone levels in both men and women. As I mentioned, vitamin D receptors are present in the testes and ovaries, and deficiency is directly associated with lower testosterone production. So this connection makes vitamin D particularly relevant in the context of the hormonal pillars that I've covered earlier. So the practical protocol here is the target range for performance is about 50 to 80 nanograms per milliliter, meaningfully higher than the standard sufficiency threshold of 30, which is just calibrated for disease prevention rather than athletic function. Most athletes need about 2,000 to 5,000 IUs of vitamin D3 daily to maintain levels in this range, though individual response varies significantly based on your baseline status, sun exposure, and body composition. Taking it with a meal containing fat improves absorption. And cofactors matter here too. Magnesium is required for vitamin D metabolism, which is one of the reasons why these two nutrients work well in combination. One important clinical note, vitamin D is fat soluble and accumulates in the tissues, so toxicity is possible at very high doses over time. So I definitely recommend testing baseline levels before you start supplementing aggressively, and retesting after about 8 to 12 weeks to confirm you've reached the target range without overshooting it. For most athletes, supplementing at the standard dose, this isn't a concern, but it's definitely worth monitoring rather than just assuming. Okay, let's put it all together here. Why these 6 supplements specifically? It's not random. Each one targets a specific physiological system that endurance performance depends on. So creatine supports energy production, specifically the ATP regeneration capacity that powers every high-intensity effort with an endurance context. Omega-3s support inflammation resolution, ensuring the adaptive signal from training completes without the inflammatory response chronically impairing recovery. Magnesium supports nervous system regulation, sleep quality, and the enzymatic machinery of energy production. Collagen with vitamin C supports connective tissue integrity, the most chronically stressed and most underappreciated structural system in endurance athletes. Curcumin supports both inflammation modulation and oxidative stress buffering, the 2 most common physiological bottlenecks in athletes with very high training loads. Vitamin D supports muscle function, immune regulation, hormonal production, and bone integrity all simultaneously, making it one of the highest leveraged single nutrients on this entire list. Now, when these systems are supported together, the compound effect on recovery and performance is meaningfully greater than any single supplement will give you in isolation. And here's where I want to leave you with an important distinction here. These supplements support the right systems, but they work within a system. So if training is poorly structured, nutrition is inconsistent or poor, or sleep is chronically insufficient, these tools are going to have some limited impact. The foundation always comes first. Supplements are what you layer on top of a foundation that's already very solid. And if you're doing the fundamentals well, using these supplements consistently, and performance still isn't where it should be, that's when lab testing becomes the next critical step. Because at that point, you may be dealing with specific micronutrient deficiencies, hormonal imbalances, elevated oxidative stress, or even gut dysfunction that's limiting absorption. And those require a more targeted, individualized approach than any general protocol is going to give you. Now, this is exactly what we'll be covering in the next couple of videos in this series. So please hit the like and subscribe. I post science-backed content for athletes at every stage and level. And for individualized testing and supplement protocols built around your specific physiology, please visit naturalathleteclinic.com. I'm Dr. Jason Barker. Thanks for watching, and I'll see you in the next one.